Hi, my name is Alex, and I am an instructor for GPACT, Global Professional Association for the colon hydrotherapists. And I am a colon hydrotherapist, advanced level trained, and I am also a nursing student graduate. I'm going to teach you a little bit about the digestive system because it's important as a colon hydrotherapist that you have a good foundation of the basic anatomy and physiology of the digestive system. We're going to start with the different parts and what they do and why they're important. So beginning at the mouth, it's the very first stage of digestion. It's important as a colon hydrotherapist to know that when people chew their food properly, you're going to notice that during the colonic session. You're going to see whole pieces of food if they're not doing that properly. In the mouth, we have salivary glands. We have also the first stage of digestion, which is the process of breaking down food, which starts with the amylase digestive enzyme. Amylase digests and helps to break down carbohydrates and starches that we eat. When the food passes through the esophagus and through peristalsis and muscular contractions, it comes down through the esophagus, is dumped into the stomach. That's the next phase. So when somebody has food that they have dumped into their stomach, the stomach produces hydrochloric acid, which sterilizes and acts as an antibiotic. It acts as our first line of defense against bacteria, protozoa, viruses, parasites on the foods that we eat if we don't happen to wash them properly. The hydrochloric acid also stimulates the release of pepsin, which is an enzyme that helps to break down protein molecules. We have this pyloric sphincter here, this pyloric valve. It opens periodically to dump food into the very beginning of the small intestines. And when this happens, it also triggers the gallbladder to release some of the bile. And when the bile is released, it helps to emulsify our fats that we ingest. We're going to see a lot of clients with gallbladder disease, so it's important that we know and understand the function of the gallbladder. We're going to be educating people on fatty stools and also with digestive enzymes as well. The duodenum is the very beginning of the small intestines. That is the very first area of the small intestines that actually absorbs the nutrition and the nutrients out of our foods. So it's important that the first stage and the second stage has done their job properly so that the people can not be malnourished, obviously. So this is a semi-permeable membrane. We want a nice pink, healthy mucosal lining. People with gallbladder disease or that have no gallbladder actually have chronic dumping of toxic waste that can irritate this lining, which is not good. The food slowly dumps, mixes with the bile. It also starts to get absorbed in the beginning of the small intestines. We have about 25 feet approximately of small intestines in our body. So it takes about 3 to 5 hours to travel through that 25 feet. Also in the beginning of the small intestines, not only is the gallbladder triggered to release bile, but the pancreas is also triggered to release a lot of digestive enzymes. That's where most of our digestive enzymes come from. The pancreas spits out trypsin, it spits out lipase, it spits out amylase, and a variety of other digestive enzymes that help with the breakdown of our food. If this pancreas gets blocked by a gallbladder stone, a gallstone, that can be very dangerous because the enzymes in the pancreas are inactivated until it exits the pancreas and starts to break down the food. That's when they activate. But if there's a blockage there, we need to know as therapists that, that's a pretty serious condition and we need to send our client to the doctor if they're having pain in this area or if they're eating certain foods and it's causing pain in this area as well. But what happens is if the enzymes are blocked and can't get out, they will become activated inside the pancreas, at which point this is called autodigestion. And autodigestion means that it's basically the enzymes are going to eat the pancreas itself. Once it hits the duodenum, it's going to hit the jejunum, which is the middle of the small intestines. It's continuing to absorb the nutrition and nutrients and vitamins and minerals out of your food. But by this time in the jejunum, there's not much left. It's going to hit the duodenum, or I'm sorry, not the duodenum, the ileum of the small intestines. The ileum is the final part of the small intestines that connects to the cecum through the ileocecal valve. Basically, what's traveling through your small intestine is food waste and liquid waste. It's all liquid. So it dumps into the cecum as a liquid, and as your colon performs peristalsis and pushes the fecal waste up and over and out, it's sucking the water out of that and dehydrating that fecal matter. That's why it's hard when it's coming out on the other side. So here on this side of the cecum, which is about 3 inches in diameter, it also has the appendix and the appendiceal orifice, which if a person is chronically constipated and they're constipated all the way through their colon, that orifice can get fecal matter stuffed into it. And that can cause irritation and inflammation, which then we have appendicitis. Appendix is at first was thought to not have a function. However, recent studies have shown that the appendix is also now what they consider a storage tank for probiotics and good bacteria. The cecum is the largest part of the colon. It's where it receives the fecal matter. It dumps into the cecum first. This is the ascending colon pushing it up. It's the peristalsis is reverse here in the ascending colon. We have the hepatic juncture, which is on the side of the liver, and the hepatic juncture is this nice curve in the colon. Sometimes as colon hydrotherapists we need to be aware of these curves, because as with any plumbing, any curves in any plumbing is going to be the very first place that you're going to see congestion or blockage. So these are pretty common. The corners are pretty common for blockages. Up through the hepatic juncture, it goes over to the transverse colon. What happens when it travels through the transverse colon is it is still getting dehydrated, and usually it's starting to become solid matter. And in some people, and this is something where you're going to use your palpation skills, because you can actually feel if somebody has a blockage in their transverse colon, you can actually feel a hardened, almost like a rock, sitting up in the top part of their, right underneath the rib cage. And sometimes you don't know how people are structurally built. So people can have a very large dip in their transverse colon, and this can cause them a lot of problems and a lot of issues. Colon hydrotherapists can help them with this, but it's basically just a structural issue. Colon hydrotherapy can help with, relieving that blockage, softening up that fecal matter, and removing it. But it's a structural issue, and this is something that they're going to suffer with for pretty much the rest of their life if they have that large dip. It's going to reach, after the transverse colon, you're going to reach the splenic juncture, and this is the side of your pancreas and your spleen. And your pancreas also, it produces digestive enzymes. It also produces insulin. The spleen actually harbors red blood cells. Spleen actually helps with, oxygenation of the body. So it's very important that these organs are really healthy. After the splenic juncture, we're going to drop down into the descending colon. By this time, the fecal matter is very hard. So upon palpation, you're going to notice that it should be soft on the left side of the cecum, but it's probably going to be hard. You're probably going to feel hardness over here on the right side of the descending colon. After the descending colon, we're going to have this little pouch, and it's called the sigmoid colon. This is the sigmoid portion. It's a little pouch where the fecal matter goes and sits and hangs out and stays until it's ready to be eliminated. The sigmoid colon is then connected to the rectum. So what happens is you have sphincters in there, you have a good fiber diet, it's building bulk in the colon, you've got this pouch full and loaded with poop, and you're going to actually stimulate the receptors here, and it's going to stimulate the brain to stimulate the sphincter to say it's time to go to the bathroom. So basically, if you are teaching a client this very basic foundation of knowledge of anatomy and physiology of the digestive tract, you're going to be aware that they're going to be having these aha moments because things are going to make more sense to them. Doctors sometimes cannot take the time to sit down and explain to them as a colon hydrotherapist can. So they rely on you for that information. So it's really important that you understand how the digestive system works. It's important that you understand about digestive enzymes. It's important that you understand about probiotics. Colon hydrotherapists are big advocates for probiotics. Probiotics live in your colon. The predominant bacteria in your colon is the bifidobacterium, but the predominant bacterium in the small intestines is the lactobacillus culture. The lactobacillus culture is also important in the female organs in the system, and also the urinary system as well.